Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thanks for tuning into the latest edition of The Checkup. Healthcare, as we know, is unlikely to return to a pre-COVID way of doing business even after the pandemic is over. So the question in front of a lot of executives now is, how does the industry reshape itself going forward? I'm really happy to welcome Jim Skogsbergh. He's President and CEO of Advocate Aurora Health, which has hospitals in Illinois and Wisconsin, to talk about some of the challenges and opportunities that lie ahead. Jim, thanks for being with us. It's good to see you again.
Hey, thanks, Matthew. Good to see you, and thanks for having me.
Sure thing. Before we delve into some of the way that COVID and the pandemic is going to impact the industry, I do want to start with a bit of news that we're hearing out of Michigan and Beaumont Health, which you've proposed a merger with them that would create a 36 hospital system in 3 states. We're hearing some rumblings as of mid-August that some physicians are concerned that the Beaumont board is going to put off a vote on that merger. So where do you see things lying with that merger?
Yeah, we're very excited about the Beaumont opportunity and have great respect for the organization. Clearly, they have some internal issues, no doubt about it, that have kind of come up of late and being reported in various news outlets. All I know is that their board is sort of taken a vote on this 3 times and have voted unanimously 3 times. Then this mostly physician, relatively, I understand, a small group of physicians have pushed back, and I think they need to kind of take care of their own internal things first, and then turn their attention to the merger. So, if they can pull it off, that'd be fantastic. If they can't, they can't. But the ability to come together with organizations, see the world the same way. I mean, our philosophy hasn't changed. Our strategic approach hasn't changed. We're hopeful that Beaumont can maybe resolve their internal issues and turn their attention to the future. Matthew, I also know that there's a natural resistance to change, any kind of change.
Sure.
And these kind of transactions can be, I think, a bit worrisome for folks. We tend to look at what we're gaining, not what we're losing. So we'll see how that shakes out. We're still hopeful.
Do you have a timeline in mind of when you'd like to see a decision made?
Well, yeah, sure. We'd love by the end of the year, without a doubt, by the end of the year. But that would also include some time for regulatory approval. So,
Right.
We'd love to see a third quarter decision, and then the approval process take place. So maybe this could be effective as early as January 1.
Okay.
It would have been nice to be sooner, but I don't think that's going to happen. And again, Beaumont needs to take care of sort of their issues
Right.
within their family, and hopefully they can resolve those issues, and then we push on.
Okay. So let's take that conversation and shift it a little more broadly. Advocate Aurora is about 2 years old now, the combining of Advocate Healthcare in Illinois and Aurora Health up in Wisconsin. And obviously you sit in a unique position, having been chair of the American Hospital Association board too. As you think about COVID and the pandemic, what kind of impact do you think that's going to have on M&A activity, on consolidation going forward, and some of these standalone hospitals that are really struggling financially?
Yeah, so I happen to believe that the movement to consolidation in our industry will not change. I think that's going to continue to move forward. Tremendous pressures to improve your cost position, to improve your safety, to improve your health outcomes, all of which scale, I think, can be a contributing factor if executed properly. And of course, Matthew, the key word there is if executed properly. Now, we've had some success in our own execution, and we believe that we can do that in other venues as well. So we are big proponents on the value of scale. It's not big for bigness sake. It's really to get stronger, and that strength then can be translated into what we say is better health outcomes, safer, and less cost. So we're still very much bullish on this notion of scale. Now, got to have appropriate partners, right? You got to have folks that see the world the same way, believe in the same things, are committed. For us, it's folks that are committed to be a good community citizen, committed to improving health, committed to serving the less fortunate, those kinds of things. And, Beaumont meets that need. So whether it's Beaumont or other organizations, we're going to be involved in conversations going forward. We think there's great value in scale if executed properly.
What are you hearing from your peers across the country? Do you think that there'll be more activity on affiliations or consolidation?
No doubt. Well, I think you just saw an announcement. Cone Health and
Right.
Centara announced. So yeah, I think, first of all, a lot of these conversations were in the making before COVID. I know our Beaumont conversation certainly was. And then everybody pushed pause because it's all hands on deck, right? And appropriately so. So I think now you're seeing folks maybe re-emerging with, okay, where were we? And let's pick up where we were. Not that the world's gone back to the same, but I do think the impetus for some of these partnerships, that's probably only grown stronger.
And what kind of review then do you think, how active do you think the regulators will become? You've had some experience with that yourself, so how active are they going
Sure
to become?
have. Yeah, sure have. Well, I think it depends on what triggers you trip. So if it's local stuff, I think it's going to get very, very, scrutinized very carefully because of the concern about market power. And you referenced our failed attempt to partner with, I'm pointing out the window, to part with the North Shore University Health System, which I think is unfortunate. I still think it's a great miss
Hmm.
on the part of really for Chicagoland and so on. But I think then when you get into situations like, for instance, Illinois, Wisconsin, and Michigan, kind of hard to argue that there's a market, power there. So I believe that the regulators probably will still focus on where there's a concern about market power. And I actually think the review process is not wrong or bad. I mean, we should be protecting consumers. In
Right.
this case, consumers be well served. And
Sure.
that's why I think some of these things will probably go forward without much of a challenge, and others probably will get challenged, perhaps appropriately so.
So let's go back to that scale you're so bullish on. Talk a little bit
Yeah,
about Advocate Aurora. As I said,
yeah,
you're about 2 years old now. During
yeah.
the crisis, how have you been able to use that scale and bring the organization together in the
Sure.
middle of a crisis? Illinois, Wisconsin, we're dealing with it at different paces too.
We were, and that actually helped us. Let me explain. So, and I'll step back, big picture. We believe that and we were talking about this before the program, Matthew. I'm a big believer in finding, the silver lining in every cloud, and COVID-19 has been a dark cloud, without a doubt. But what's happened for us, Advocate Aurora Health comes together about 2 years ago, 2.5 years ago, and without a doubt, the first year, the first 2 years, very much a lot of work in progress to bring together two strong, healthy organizations with the normal bumps that typically take place. So, we always say this is not for the faint of heart because you're bringing together, you're introducing change to organizations that have been doing very, very well for quite some time. And so there's this natural resistance to change, really, in both sides. So we went into 2020, two organizations striving to become one, right? Or I should say, one organization striving to become closer and fully integrated. We'll come out of this as absolutely one very strong organization. And what I mean by that is that while COVID-19 has been a disaster economically, and that's true for all healthcare providers, absolutely a financial disaster, culturally, it's probably been a blessing for us. And what I mean by that is when COVID hit hard in Illinois, we had nurses from Wisconsin come down and take shifts at our Illinois hospitals where it was mostly very desperately needed. Conversely, when the numbers started creeping up in Wisconsin, we moved ventilators from Illinois to Wisconsin. So the ability to sort of work back and forth and frankly work collectively as a team really enhanced this culture of one organization, one strong organization. So it is Advocate Aurora Health. It's not like Advocate and Aurora. It's Advocate Aurora, and we feel great about that. So that's one example of how we've utilized our scale to benefit the patients that we serve. I think that was the nature of your question.
Yeah, it was, Jim. But I also think you're running into, if I understand right, there are some challenges you're facing, particularly on testing, right? You don't have the supplies that you anticipated. So has scale been able to help you there?
Yeah. So good question. So the biggest issue is PPE. Okay, huge issue with PPE immediately, and I think most of us in the provider community were quite anxious about the ability to protect our own team members. Fortunately, again, the scale play. Fortunately, we have pretty deep relationships with suppliers, and we also have access to a whole variety of suppliers. Matthew, we actually had a plane come in from China on our behalf, and so and the good thing is our supply chain folks champions one and all secured all the PPE that we needed. We never ran out. Even when we got close, we replenished. So no concerns there, knock on wood. But testing is a little different situation, right? So I think, again, it's a worldwide pandemic. As most of you know, and I'm sure you've reported, a lot of the testing reagents came from overseas. Well, they were sort of utilized overseas. And so we found, all of us found ourselves in a bit of a pickle relative to the testing reagents. It's not that our labs couldn't run the tests. We got capability of doing over 8, maybe 12,000 tests a day. But you have to have reagents for it. And that was the big problem. And then once those started getting built up, now we have the spike in different parts of the country, and those reagents sort of being redirected elsewhere. So one of the things we've done, again, back to the value of scale, we believe, Matthew, is we've invested in a PPE company. Now, we're not the only investor. Other healthcare systems have the wherewithal, and we want to maybe control our own future a bit, not entirely, but have a better handle on PPE. So we're a part owner in a domestic supply company, N95 masks, gowns, those kinds of things, and we're considering the same thing relative to the lab world. And the idea is to not necessarily find ourselves in the same situation in the future, if you will, being beholden to others and not quite able to chart our own course, to be honest with you. Now, we're never able to chart it completely, so that's the caveat, but being in a better position to control some of those things. So in one case, I think the scale play helped us a lot. On the testing reagents, when it's a national shortage, it's a national shortage. So, and we're frustrated with that because you could argue that the testing might be the crux of it, testing and tracing, of course.
And how is that? I think that the fact that you're investing in a couple of companies is interesting. How does the shortage on the testing front impact your ability to reopen, routine non-emergent procedures?
Yep. It certainly can have a significant impact. And of course, we don't want that to happen, Matthew. Nobody does. This notion of, shutting down even partially is sort of untenable anymore. We're actually anxious about patients who have not yet come in to get their, if you will, routine or care for their chronic disease. And folks put that off, and that's not in our patients' best interest. So we have a massive campaign to communicate and educate, saying, come in. It's never been safer to come in and get your health care. We have what is our Advocate Aurora Safe Care Promise, and we've made all kinds of changes to our procedure and our process, not just cleaning, but staggering appointments, changing waiting rooms so you have the 6 feet social distancing in place, just a variety of steps that are designed to create a safe environment for patients to come back. So we are quite anxious that patients return for the care that they so desperately need. Otherwise, you're sort of going to pay for that down the road, and we'd like to avoid that.
Sure, makes sense. And Jim, I want to pivot a little bit to the relationship you have with payers, insurers. Advocate obviously has a long history that people may or may not know about of developing even your own quality metrics with the Blue Cross Blue Shield plan here in Illinois. How does the pandemic impact that relationship and measures that you have in place that you might not meet because you haven't had procedures coming in because of COVID?
Well, the topic's huge, Matthew, and you've just touched on one. First of all, you're absolutely right. We enjoy great partnerships with the payers, and we need to, and it's mutually sort of reciprocal, right? So I know the payers are anxious to have great relationships as well, and there's always a little bit tension involved, without a doubt. Always have been, perhaps always will be. Not sure that's all bad, but if we're all striving for the same thing, which is better health outcome at a lower cost, hopefully well-intentioned people can find ways of resolving any differences, and we've been able to. But our partnership, and particularly in Illinois, the Blue Cross partnership is very, very important to us. Now, you asked how will COVID impact some of these arrangements that do have payment mechanisms and so on. So the answer is we're anxious about that, because a lot of our measures are based on, as I just got finished talking about, patients coming in to get their hemoglobin checked, get their
Right.
hypertension cared for, get their eye exam, and so on. And as people stay away, that will have a negative impact on us as providers. So I'm sure we're going to come up with some, adjustments, appropriate adjustments given COVID, and we're working through those issues. So I think we're, crossing our fingers we're going to be able to resolve that.
And do you have to recalibrate then going into 2021?
Oh yeah, I mean, I got to tell you, Matthew, I don't. This is not over. I mean, this is
Yeah.
this is a marathon, not a sprint. So, and it probably won't be over till well after there's a vaccine, because then you have to get everybody vaccinated, and we also know there's going to be some resistance to that as a new vaccine comes out. So, I think we're going to be living with this for a while, and we've learned how to live with it. That's the good news. We've learned how to live with it, and so yeah, I do believe it's going to bleed into 2021 as well.
And so lastly here, Jim, flu season's coming up. Obviously, people are now worried about a double whammy, as we're hearing. What are you doing at Advocate Aurora to talk to your patients about
Yeah.
the flu vaccine and the importance of that as we still deal with COVID?
Yeah, thank you for raising that. I hope the listeners, I hope this goes far and wide, because that notion of flu vaccine is critically important. So, as you might imagine, Matthew, we are communicating with all of our 3 million patients in both states, right, to communicate about the absolute necessity of flu vaccine. None of us wants to see some kind of a spike in Illinois or Wisconsin. And that flu vaccine is an important step. Now, it's mandatory at our organization, so all of our team members will have it. I don't know what you guys do, but it probably should be mandatory. Now, for us, we're involved in patient care and seeing patients, et cetera, et cetera. But flu vaccine is critically important, without a doubt, and we are communicating that far and wide with all of our patients.
Great. Well, I'm pretty good about getting the kids their flu vaccine. Me, I'm a little sometimes remember, sometimes don't.
Get that vaccine.
I know.
Come on by.
This year for sure I will.
I'll help you.
Well, that's a good note to end on, Jim. Always a pleasure to have you. Thanks for
Thank
taking some time. I know it's extremely busy, but thanks for being with us
Good to
today.
be with you. Thanks for everything. Take care.
All right.
Bye-bye.
Thank you. And I'm Matthew Weinstock with Modern Healthcare. Thanks for tuning in. Be sure to come back next Monday for the next edition of The Checkup.